Okay, while I'm waiting for people to join this video, I think I'm just going to start because I have limited time. So once I'm done with the whole live video, I will save it and post it on my feed. So I'm just going to start. I am Dr. Amarachi Ijeoma. I'm a fertility physician, and earlier in the week I asked people to send in their fertility questions so that I will be answering them today on my live. This makes it easier for me because having to get so many questions in my DMs and answering everybody individually is not really effective. So collating these questions and then answering everything at the same time is actually better for me. So because I'm actually using my phone to film this live video, I have written down all of your questions on a piece of paper, and I'll be reading out the questions from this book and answering your questions. I'll try to make this video as short as possible so that the video, when I save the video, it's not long. Oh, the first person has joined the video. Thank you, welcome. I'm really excited for you guys that are joining this video. And I just finished thanking you guys, and I am going to start answering the questions. So the first question is from Chisom. Chisom asked, I have been having irregular periods and ovulation for the past 2 years. So if I want to start having kids in the future, how can I keep up with my fertility cycle? Okay, so Chisom, irregular periods is actually as a result of hormonal imbalance. And the most popular cause of hormonal imbalance is actually polycystic ovarian syndrome. However, you have to go through a series of investigations for a diagnosis to actually be made. These investigations that you will go through are so that we can actually find the cause of your hormonal imbalance. So let's just talk about the most common cause of polycystic ovarian syndrome. The most common cause of hormonal imbalance, which is actually polycystic ovarian syndrome. Now, this syndrome is a hormonal disorder that actually causes your ovaries to enlarge and causes you to have like multiple cysts at the edges, on the edges of your ovary. The cause of PCOS is actually not known, and when you have PCOS, you might complain of, having hair on your chin, having hair here, having hair on your chest, your lower abdomen. You may complain of weight gain, sudden weight gain. You may complain of acne, and you may even notice that your sugar levels have slightly increased. But these investigations have to be done for this diagnosis to be made. However, if you have PCOS, there's actually a management for PCOS, and that would include dieting, lifestyle changes like dieting, maintaining a healthy diet, exercising regularly, and weight loss, basically, if you've added weight. So Chisom, you said, how can you keep up with your fertility cycle? If you've noticed any of these symptoms that I've talked about, then what you have to do, what you need to do is actually just mainly lifestyle changes. So I'm going to go to the next question, which is from the next question is from, okay, I'm not going to call her name because her question is really long and it's a little bit personal. So she asked, my menstrual cycle is pretty messed up, so I don't even know when I'm ovulating. Like, I've been having my period since November, though it stopped in January, and then after a week it continued again. But this time, the flow wasn't as much as the ones I had from November till December with a jelly-like substance. I don't understand. Though I was pregnant in November, I had a miscarriage and evacuation was done and everything was fine. Not until November 30th the heavy bleeding started up until now. So I'm worried. Please, ma'am, I'm scared. I hope this has not affected my fertility in any way. My partner and I have decided that it is time to get pregnant again, but the bleeding is what I'm unsure of. Please help. Okay, so the truth is that I just answered part of your question because, you know, Chisom has a similar question to yours. And like I said, the most common cause of irregular cycles in women is actually polycystic ovarian syndrome, popularly known as PCOS. So I don't want you to be scared, because the fact that you have PCOS does not mean that you cannot get pregnant. It just means that you're not ovulating as regularly as other females, and it just means that you just need to work on your lifestyle habits. So what you should focus on right now is healing from the miscarriage that you've had, because you need your mental health intact. You also need to just focus on your diet, exercises, and if after a few months you've still not conceived, then visit a fertility expert so that investigations can be done, so a specific diagnosis can be made, and so that you can start treatment if needed. I hope I was able to answer your question. The next question I'm going to be taking is from, okay, let's see, from Oscar. Oscar asked, at what age can a man not be able to get a woman pregnant? And at what age can a woman not be able to get pregnant? Oscar, for men, there is no particular age. Your question is a little bit vague, because I'm saying this because even if you are 25 or 30 as a man, if you have problems with the quality of your sperm for whatever reason, maybe a disease condition, then you will not be able to get a woman pregnant. So, but to answer your question, sort of, when men get to the age of 40, their fertility starts to decline. And when their fertility starts to decline, it means that there is now reduction in sperm count, reduction in the movement of the sperm, you know. So with increase in age for men, fertility also decreases. So Oscar, I'm going to give an average of 40 years old for fertility to start declining, not that the man will not be able to get a woman pregnant. Then for the women, you asked at what age can a woman not be able to get pregnant? Well, women can actually get pregnant even after menopause. I mean, thanks to IVF, in vitro fertilization. So if you mean that at what age can a woman not be able to get pregnant naturally, then I would say it's usually from between age 37 and above. Now, this is not to say a 39-year-old or a 42-year-old woman cannot get pregnant naturally. No. So these things are not cast in stone. It's just fertility really significantly declines after age 37. It doesn't mean that all women will not be able to conceive naturally after that. This is just an average. So the next question I'll be taking is from Nature. Nature asked, can you shed light on PGD, pre-implantation genetic diagnosis? I don't know if that's something you can cover as well. For couples that might be both AS and want to check their options, costs and all that, or also the whole checking the genotype of the child before it's born to know and all. I don't know the medical term for that one. So what Nature is trying to ask is for me to shed more light on pre-implantation genetic diagnosis, because in Africa we have like sickle cell anemia, and this it's like a genetic disorder that makes the red blood cell that is supposed to have a round shape have a sickle shape. A sickle shape is like half of a moon, a half moon. So when the red cell is shaped like that, it can actually lead to breakdown of the red blood cells and cause anemia, that is low blood in the body. And they usually AS people are carriers of this gene. SS people are actually the ones with sickle cell anemia, and people with sickle cell anemia usually presents with pain, excessive pain. Now nature is asking, when an AS and an AS person marries, because the chances they will get a sickle cell child is 25%, that's a 1 in 4 chance. So he's asking if there is a way to prevent it. So apparently there is a way with IVF, and it's called pre-implantation diagnosis. So what happens is, after the whole procedure of IVF, which I will just summarize, which is taking the egg out of a woman, taking the sperm from a man, fertilizing it in a dish outside of the body, and then transferring the embryo back into the woman. Now, before you transfer the embryo back into the woman, you allow this embryo to stay for 5 days in the incubator. So on the 5th day, which is the blastocyst stage, what happens is the embryo is taken and is tested. So the lab scientists will conduct like extensive tests on this embryo by taking out a cell from it. They'll also take samples from the parents also. They might even go as far as taking samples from family members. They're just trying to match the chromosomes, the traits, and all of that. So what they do is they now tell you the embryos, the ones that have sickle cell, the ones that have the carrier gene, and the ones that don't even have the gene at all. So you now decide the one you want to be transferred to you. Yes, this PGD is actually accurate, but however, IVF itself is not accurate. So you should have that in mind, nature. So my next question, the next question I'll be taking is from, okay, I did not number this well. So, okay, Temi asked, is IUI the same as IVF? Okay, so IUI is not the same as IVF. IUI is intrauterine insemination. In IUI, what we are doing is just stimulating the ovaries to produce 1 or 2 eggs, and then transferring the sperm into the womb to go and fertilize the eggs. So in IUI, the tubes, the fallopian tubes, are supposed to be patent. They are supposed to be open because the sperm needs to swim all the way to get the egg. So I actually talked about how a baby is formed in my latest video. You can actually check that out if you don't really understand this explanation. But an IUI is also done in women that are still producing eggs. So you must still be producing egg as a woman. You must actually have patent tubes, and then the sperm must be of good quality, must have optimum motility and counts. So these are the indications, and these are the requirements rather for IUI. However, IVF, you are bypassing the womb, you are bypassing the tubes, you are bypassing everywhere. What you are doing is stimulating the woman to produce multiple eggs, and then you're going in to take out all of the eggs, as much eggs as you can take, and then fertilizing outside of the body, then transferring the embryo back into the tubes, into the womb rather. For IVF, we don't need the tubes because, I mean, we are just going to do the whole fertilization outside of the body and then transferring the embryo to the baby bed, to the endometrium, just to go there and grow. So yes, that's the difference. Also, there's a difference in cost. IVF is way more expensive than IUI. So the next question I'm going to take is from Nimat. Nimat said, I did HSG and pelvic scan and it shows everything is fine. Maybe a drug to enhance conception. Nimat, I'm glad everything is fine with your HSG and pelvic scan. Drugs to enhance conception. Well, the only drug I would advise you to take is prenatal vitamins, the ones that contain folic acid. Check the container to be sure that it contains folic acid or folate. They would usually write like 400 micrograms of L-methylfolate. Make sure it's up to 400 micrograms. And then also check for another ingredient called DHA. Folic acid helps to prevent neural tube defect, and DHA helps for fetal brain development. So Temi, Nimat, I hope I answered that question. Paul asked, in a childless marriage, how best do you determine whose fault it is? Okay, so how to determine whose fault it is? You go to see your gynecologist, your family physician, your fertility specialist. Usually they'll conduct extensive tests on both the woman and the man, because of course both are implicated in infertility. So they'll do all of the tests to check for female infertility. They do all of the tests to check for male infertility, and then with the result of these investigations is how you actually know whose fault it is, like who the problem is from rather. So you should also know that sometimes there's no problem with both the man and the woman, and there's something called unexplained infertility, which means that after a series of investigations, after doing all the standard infertility tests, there was no cause for the infertility. So what happens is it's termed unexplained infertility. So Paul, that's the way to actually find out who is responsible for who the infertility is actually from. So the next question, the problem now is that I didn't arrange this thing well in my book, so I'm just going to be flipping and flipping till I find the questions. Okay, so the next question is from Ariel. Ariel asked, Doctor, please, what is the success rate of IVF, and can you break down the costs? So this is a question that a lot of people ask, and what's the question again? Success rate of IVF. Okay, so the success rate of IVF generally is between 35 to 40%. That's globally, with an average of, on an average, you can just say 39% successful. However, with age, the success rate differs. Like in women younger than 35 years old, success rate is about 35 to 43%. Then greater than 35 years old, it keeps decreasing and decreasing and decreasing. In women greater than 50, it's almost less than 5% successful. So the cost of IVF. So for me to actually break down the cost of IVF, then I have to talk about the different types of IVF. And the different types of IVF is using own egg, that's the woman's own eggs, and the man's own sperm. So that's a rough estimate of 1.2 to 2.5 million naira. So I'm going to be saying this in naira. And then if you're using a donor egg and own sperm, that would be about 1.8 to 3 million naira. And if you're using donor egg and donor sperm, that will be between 1.850 to 3.550. And then if you're using a surrogate, by the time you put into consideration the amount you're going to pay the surrogate, all the logistics around it, accommodation, feeding and everything around it, you're looking at 4.6 million to about 6 million naira actually. So if you're doing PGD, that's the pre-implantation genetic testing. So nature, that reminds me, you asked for the cost of PGD. It's also, PGD alone is between 2.5 million to 3.5 million. So when you're now doing it with of course you have to do it with IVF. So it is now going to be between, we are adding, okay, so just add the normal cost I've given for IVF with the cost of PGD, and that will give you the cost of the whole thing together. So it's pretty expensive actually. Next question is from Ngozi. Ngozi said, "Good day, doctor. Please, people with 28-day cycle, when is their ovulation day or date? Have problem calculating it." Okay, so Ngozi, I'm going to make this very easy for you to calculate. So today's your lucky day. So Ngozi, it's easy. What you just do is, if you know your cycle length, subtract 14 from it, and that is your cycle length. For example, a 28-day cycle, subtract 14 from it, it will remain 14. Your ovulation day is on day 14. If you have a 30-day cycle, subtract 14 from it, and your ovulation day is on day 16. However, the ovulation day is not actually like specific. So just, you know, just add 2 or subtract 2. So plus or minus 2 is your ovulation. So it's just that that's an average. Once you subtract 14, for example, a 30-day cycle, subtract 14, you have your ovulation on day 16. However, it doesn't actually mean that your ovulation must be on that day 16. So it can be either day 17 or day 15, but it's just to give you a sort of like an idea of when it can be, when it could be. Ngozi also asked one more question. The folic acid, is it to be taken on regular basis or when you want to conceive? That is for those that want twins. Okay, so the thing is that folic acid should be taken every day. The truth is, once a woman has reached reproductive age and she's sexually active, the advice is actually, the counsel is actually for you to start taking folic acid every day. This is because we are trying to prevent a disorder that can actually occur in the baby called neural tube defects. So that is why we advise every woman of reproductive age that is sexually active to be taking a daily folic acid. So in women trying to conceive, we even buttress this even more, because we don't want you to have your baby to have neural tube defects. So now you're saying that for those that want to have twins, this is sort of like a myth, because this study is not in conclusion. So we have a lot of studies saying, well, there might be an association with folic acid and twins. And then we have other studies saying there is no association with folic acid or twins. So this is not in conclusion. You're just taking folic acid to prevent neural tube defect. And some studies also say it also helps with fertility. So yes, take folic acid every day. Next question is from Noya. Noya said, "Good afternoon, ma'am. Please, aside supplements, are there foods one can eat to boost egg quality and sperm quality too?" So Noya, the truth is that when you go out there on the internet, on social media, you're seeing lots and lots of meals that you should take in particular that will boost your fertility. Well, I'll say, Noya, eat fruits and eat vegetables. Fruits and vegetables are actually good for even people that are not trying to conceive. But for people trying to conceive, research has shown that it even has an added advantage by helping to increase the quality of the sperm and also the egg. However, I think you said to boost egg quality, okay, so it has also shown it can actually boost egg quality as well. So the main thing is just maintain a healthy diet. No, yeah, you can eat every type of food you've been eating in the past, except of course carbonated drinks. Tone down on that. I mean, even when you're not trying to conceive, it's not really a healthy sort of thing to put in your body. So let's just focus on the fruits and the vegetables, and we are good to go. So next question is from Mr. Mr. said, hi, is it possible to educate men on living healthy and tips to a healthy sperm? Okay, so I like this question a lot because the truth is, men believe some men believe that it's the women that are supposed to take care of themselves, you know, for fertility issues and all that. But this question is even from a man saying I should talk about and explain healthy habits to actually have a healthy sperm. So number one, the sperm doesn't like a hot environment. So avoid tight fitting pants. I think we should stick to cotton pants that are free so that air can get there to your testicles and all that. Also, avoid putting your laptop on your laps because, I mean, the heat from the laptop can affect the sperm cells. So what happens is when you leave your laptop on your lap for hours, it can cook up your sperm, and this can lead to reduction in low sperm counts. Some studies have even shown that there's some radiation from the laptop that also affects the motility of the sperm and the quality of the sperm. So let's avoid anything that will cook up our sperm cells. Then also vegetables. Eat vegetables, eat kale, eat broccoli, eat all the vegetables that you can find. Eat fruits also. Diet also helps. So okay, so I'm looking at the comments now. Thank you, Omar Zoimelam, King Mufasa, Ada Obiwulu. Yes, thank you. I can see your comments. Also, like I said, eat fruits and vegetables, and then exercise. Exercise is actually a good way to actually have a healthy sperm. So the next question I will go to is from Eze. Eze said, greetings doc, please what do I do to conceive a baby boy? Thank you. Okay, so I've done a whole video, Eze, on how to conceive a boy and how to conceive a girl. But since you asked, I'm going to just summarize really quickly. So how to conceive a boy. First, you have to be able to calculate your ovulation day. And then, when you know your ovulation day, for example, if you have a 28-day cycle, your ovulation day is on day 14. Then you want to time your sex to 3 days, anytime from 3 days to ovulation. So 3 days, 2 days, 1 day, that day of the ovulation, you should be able to conceive. The chances of conceiving a boy is about 60%. So if you want more explanation on that, then you would have to check my video on my YouTube page and on how to conceive a boy for more detailed explanation. So I think I am done with all of the questions, but let me check again to be sure. Okay, so I am done with all of the questions, and I hope I was fast enough because I really don't want this video to be long. Thank you so much, all of you that have tuned in. I am so grateful, and I hope you guys learned, and I hope I was able to answer your questions. I would love to do this more often so I can be able to answer as much questions as I can. Thank you for joining my first live session, and I will see you guys next time I decide to do a live video. Thanks for watching. Okay, I can see your comments. Thank you guys, and good night.